So we're going to be talking about how we can come off our meds, right? So the first thing that I really want to talk about is how possible is it for you to come off your meds if you are on meds for a chronic health condition that is caused by your lifestyle, your food, your diet, your exercise, your stress? How possible is it if we could come off of those meds? Could you address
So
that?
I'm, yes, and I'm so glad that you specified chronic lifestyle related
Yeah.
diseases, because there are going to be some conditions that are not chronic lifestyle related. Maybe it's a genetic disorder or something where you need to take a medication. But when we're talking strictly conditions that are related to a poor lifestyle, that is where it is absolutely possible to get off those medications over time.
What,
Um,
what are some of those conditions? List them out.
yeah, so I would say some of the main ones are going to be type 2 diabetes, high blood pressure or hypertension,
Yep.
high cholesterol or hyperlipidemia, uh, even cardiovascular disease. Depending on whether or not you've had some kind of an event in the past or not, it is possible that you could get off some of those medications.
Yeah.
Um, yeah, so that's kind of some of the big hitters, I would say, for people who come in with those conditions. And then, of course, now we're dealing with weight loss drugs as well. With the medications like Ozempic that people are taking that used to be more of a diabetic drug, now being used for weight loss.
So
So that's
much.
another chronic lifestyle related condition, right?
Yeah.
Having excess weight. And if you're on a medication for that, being able to reverse that condition using lifestyle changes is absolutely possible. And I've seen plenty of patients coming to me on those types of medications, not feeling well, having
Yeah.
gut issues, and they're saying, I don't know that I really want to be on this anymore. What else can I do? Right?
I,
So,
I was going to
absolutely.
say the exact same thing. Clients are coming to me and they're saying, my doctor put me on Ozempic, my doctor put me on Monjaro, and my doctor put me on this and that. Can I still do this way of eating? And the answer is no matter what your doctor puts you on or says or surgeries you're having or whatever they're saying for your health condition, you could always, I think, you tell me if you agree or not, you can always take control of the things that you can control. And one of those is what you put in your mouth 3, 4, 5 times a day. Whether
Absolutely.
it heals you or harms you is something that's under your control. Do you agree with that?
Yeah, and I love that you say that about being under control or in control of your health, because I have seen, especially before I was working as a lifestyle medicine physician only, when I was in residency working as a family medicine doctor, I saw a lot of people who were just depressed and hopeless because
Yeah.
they were on a lot of medications. They didn't feel like they had a choice, right? Their doctor was just signing over these scripts and like, oh, it looks like we need to add another diabetic medication, or we need to add another blood pressure medication.
Yeah.
And they just really felt like they didn't have a choice in that, and that they just had to do what their doctor said. And 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 not knowing that there is not only an additional thing that you can do with the lifestyle change, but something that's almost alternative in a way, that if you start making those lifestyle changes and start improving your health, then now you can start getting rid of those medications and just
Yeah.
living that healthy lifestyle. So absolutely, it puts the control of your health back into your own hands instead of just relying on a doctor who honestly sees so many people every day, day in, day out. It's really hard to give that personalized care when you're seeing someone for 10 minutes.
Yeah.
And I don't fault the doctors completely, and especially because we don't get that kind of training. We don't get lifestyle medicine training in medical school or in residency, really.
Well,
But
I, all right, before I respond to that, what I want to say is if anybody's on the live stream, can you comment or smash the hearts and the likes button so that I know that you can hear us and see us? Because I'm not seeing any comments. I usually have a million comments and it could just be the live stream. And in fact, maybe I can pull out another phone. Where is that other phone? I could pull out another phone and see if
I
the comments are
just
on
saw a
there.
thumbs up.
Um, So, what I wanted to say in response to that is that I was that kind of patient when I was recovering from breast cancer. And, I thought I, knew about kale and berries and they were important. And I shopped at Whole Foods and I had a feeling that cancer had something to do with the food. And when I asked my oncologist and I begged her to tell me what to eat, and she just looked me straight in the eye and she just said, it doesn't matter what you eat. And inside, I just like died a little bit. I was like, oh my God, what am I going to
Yeah.
do? I have goosebumps whenever I
Yeah.
think about that day.
You
So
probably felt really hopeless, right? That
hopeless.
there's
So the
absolutely
fact that
nothing
you
that you
say
could
that,
do.
that's what we're here to tell you, you guys, is that there is hope and you can take control. All right, now I see some comments. Good, thank you.
Yay.
All right, Colleen says she can hear me. Elise and Ramona are here. This is wonderful. Okay.
Okay,
All
good.
right,
And
very
by the
good.
way, Naomi, I have two dogs at home here. One of them is a brand new puppy. So if you guys start noticing too many noises from them, let me know and I'll go grab them and put them on my lap or something.
Interestingly, I got a new dog.
You did.
I rescued a stray dog just like 2 days ago, and she's right there too, but she's kind of
Oh,
quiet. She doesn't really bark too much yet because she's still like brand new.
trying to figure that place out.
It could happen. It could happen though. Um, all right. So back to what we were talking about. You're not hopeless. There's no hopeless. We can always take control. So that's what we're totally here to talk about. So, and we're going to be talking about how to talk to your doctor about getting off the meds. So, how do I know? People might be thinking, how do I know if I'm over medicated right now? I'm thinking of a patient of yours who was a client of mine who came to you and she was on so many medications that she had been on, like, I don't know, for like decades or something. And you were like, what is this even for? And she couldn't even remember. So,
Well,
yeah,
that
how do you
okay,
know if you're over medicated right now?
so that actually brings up a really good point that I didn't even consider until you said that. It is so important that you know what you're taking and why.
Yeah. And
I
how
cannot
much,
tell
even, I
you,
would say.
yes, and I can't even tell you how many people I have come across where I look down their medication list and I say, okay, what is this one for? And they can't tell me. You
Mm,
need to know why your doctor has prescribed something, what it is for, so that you can then advocate for getting off of it if you don't need it anymore. Because there are a lot of people who are put on medications that honestly are never meant to be long-term
mm.
medications that now all of a sudden they just keep getting recycled on the same, right? You're just getting refills and you're getting refills, and then before you know it, you have no idea what it's for, but you just keep taking it because you always have. So
So,
that's
so
really
you don't,
important.
so you don't want to blindly be just taking medications. We need a list. That's an action step for everybody listening. That's an action step. Get your medications out. Know what everyone is for and how much you're taking. That's a really big one. All
Yep.
right. The question
So we
was,
need to know
how do
that.
I know if I'm over medicated right now? Okay.
Yeah. So then once you know what you're on, then you can come to, either your primary doctor or a lifestyle medicine doctor like me and talk through all those medications to figure out, are all of these something that you should still be on? Okay. So then you can figure out, is that something that was it meant to be continued? Because when you change doctors all the time, maybe you into the
Yeah.
hospital, you got out of the hospital, right? We're not really good at making sure that those medications are accurate all the time. I mean, unfortunately, clinics, hospitals, doctors, nurses make a lot of mistakes out there. So you need to make sure that you know for you what you're meant to be on, because some of those medications just continue to get added when they really shouldn't be. So that's that. And then as far as just knowing when you yourself are over medicated, I would say, a couple of the main things to be considerate of would be, so blood pressure, absolutely. That one, as you're making lifestyle changes, I should say, that is something that you'll see the effects of pretty quickly
You
for
feel
most
it.
people. You feel it. So you'll become lightheaded or more dizzy. When you stand up, you're just feeling more lightheaded more often.
Yeah.
And honestly, it's funny because people don't even really think about that could be a medication problem. They're just like, I just have been feeling, more lightheaded when I stand up lately.
You
And
know,
they don't
you
even think
know,
about it.
I think that's so funny that when I because I know what all my clients are on, and so when I see that they're losing a certain amount, well, they're losing weight steadily, and they've been doing it for like even a month, I'll be like, watch out for your blood pressure meds. Watch out for those low blood pressure symptoms. That is a sign that you're over medicated. You need to call your doctor. And so, like, we have a list of that. Yeah.
Good. And
So blood
that's,
pressure is the lightheadedness, the dizziness,
yeah.
even sometimes like a dry cough.
Well, that's actually a side effect of a specific medication
Yeah.
called an ACE inhibitor. So that is something that is not necessarily from being over medicated, but it
Mm.
is absolutely a side effect that is very common that a lot of people, I've had plenty of patients that come to me saying, I have this cough that I just can't get rid of. And turns out that they've been on this ACE inhibitor for quite a
Yeah.
while. And
Yeah.
that's an absolutely known side effect of that.
Okay. What else? What are other ways you know you're over medicated? You did blood pressure meds. What else?
Yeah, so and then I would say in diabetes, I've seen this many, many times where people start to make lifestyle changes and because diabetes type 2 is lifestyle related,
Mm-hmm.
your blood sugar usually improves pretty quickly as you start to make those changes. You get rid of the animal foods, the oils, the high fat, and you start focusing on low fat, whole food, plant-based. Your cells can breathe again. I know that sounds kind of funny. It's not really literally, but you're opening up the ability for your cells to actually use the blood sugar, where insulin can do its job and you don't
Yeah.
have that insulin resistance that is very common and, well, is what type 2 diabetes basically is.
Yeah.
And so that's another thing, especially if you're type 2 and you are on
Insulin.
insulin
Yeah.
or a medication called a sulfonylurea. If you're on one of those, you want to look over your list, find out what you're on. Are you on something like that? Those are very prone to shooting your blood sugar down low. So as you start to make these changes, now all of a sudden you're at a higher risk of having your blood sugar go too
Too low.
low, which below
Oh.
70 is technically hypoglycemia. But some people feel the effects of low blood sugar even at 80 or 90. Some people, it doesn't affect them until 50. So you really do need to watch. And if you start feeling off, check your blood sugar, see
Yeah.
where it's at.
um I had a client who after 4 days she had to call her doctor for an insulin reduction.
Yeah.
4 days. And she was eventually able to come off both of her types of insulin. She was on fast acting and slow acting and
Mm-hmm.
metformin. She was able to come off of all of it.
Yeah. Yeah.
um
And I see that too. And actually, the two conditions we're talking about, type 2 diabetes and hypertension or high blood pressure, those are the most common that are, that you need to make that change to your medications quicker
yeah.
because of the dangers of low blood pressure or low blood sugar. And so, because of that, often if I have someone very motivated going from more of a standard American diet and they say, okay, I've cleared out my pantry, my fridge is full of delicious, healthy plant foods. I'm starting tomorrow. I say, okay, we're going to stop this med. We're going to stop this med because I already know that if you are committed, we're going to be over medicated very quickly.
Yeah.
And that's something that I actually learned from Dr. McDougall. That's something that he would do in his 10-day live-in retreats in Santa Rosa. He would stop the medications day one because they were in a confined space, right? He knew they were going to be eating his food for the next 10 days. And
True.
he knew
Yeah.
early on that those people were going to have issues if they didn't decrease those meds right away.
Right. I don't have the same kind of controls going on, so I can't
Right,
like
exactly.
tell them. So what with the clients that I'm working with, their doctors are going to require proof, so they're going to have a week's worth of blood pressure readings to show them,
Or,
or they're going to have a
or,
glucose monitor that shows the time in range or
or
something
side
else.
effects, or
Yeah.
side
And,
effects.
and the
If
side
you start
effects.
feeling off, you start getting dizzy, you just call them right away. They don't need proof.
Yeah.
And they'll know that that is a sign that they are over medicated. The other thing to consider is to be sure that you let your doctor know when you're going to make a change like this,
So
right?
that's what I wanted to talk to you about today. So how do we let the doctor know that we're going to make a change like this? Because they don't most people do not want to make a change like this. So they're used to just doling out the meds and saying next. Not their fault. That's just the way the paradigm is.
Right.
So how can you like stop them and say, like, hey, I want to make a difference. I want to get off these meds. Like, what, how can we do that?
Yeah, honestly, I think that when you have that kind of a conversation with your doctor, it's refreshing for the doctor to hear someone be motivated to make changes and want to get off medications, because most of the time that's not what they see. And it is, part of it is because they're not really being told by their doctor that it's possible,
Yeah.
right? So I do think that it is important to have a very honest, open discussion with your doctor. And if you need to share books or studies or anything like that to kind of get them on board, you know, I mean, anything you can to just let them know, like, this is something I'm interested in. This is what I've looked into. I will say it's good that we now have the American College of Lifestyle Medicine.
Yeah.
And we also have tons of data out there to support a whole food plant-based diet for so many different conditions. So it's not like it's just some, oh, should I try this kind of quirky supplement to, that you've never heard of for this
No, right.
disease. It's something that's very well studied.
But,
Um,
like,
but
for an example, a woman texted me the other day, and she actually sent me what her doctor sent her in the my portal thing.
yeah,
uh she had very high cholesterol, and the doctor wrote a whole big thing about how uh she really should, look at the Mediterranean diet, which is fine, right? And that she should focus on healthy fats of olive oil, avocados, and nuts, and that she should increase her protein with lean poultry, meats, and fish. And like, doctors, like, they still have
I know.
never heard of this. Like, I
I
don't
know.
understand. Like, they have never heard of it.
I know.
And then I had an actual client who went to tell her doctor this, and this is the one who got off the insulin and the metformin. And her doctor was so rude to her that
Yeah.
she like snickered at her and said, "Okay, good luck with that."
Oh,
So
yeah. And
rude.
I've heard that
My
too.
client was almost in tears about that.
Yeah. And I actually had a patient where their provider rolled their eyes when they
Rolled
were
their eyes. So what do
rolled their
you
eyes
do
at
in that
them.
situation? What do you say back, or what do you
Well,
do?
so here's the thing, you don't need to keep a doctor that isn't going to be supportive of you.
No, you
I mean,
don't.
you don't, right? I mean, you can do your best to try to let them know that you're interested in your own health and that you want to try to reverse your diseases using diet.
Yeah.
If they don't, if they won't listen and they don't understand, there's not much that you can do to change that. I mean, there are going to be some. I mean, there are plenty of lifestyle medicine doctors practicing today that's how they learned about lifestyle medicine. That's how they learned about a whole food plant-based diet. It was through their
Through
patients,
their
their patients
patients.
actually
Yeah.
getting better,
Yeah.
right? So it is possible, but if you don't have someone who's supportive and they're just telling you, no, that's ridiculous, you should not do that, that's stupid, I can't believe you're even trying that, then that's probably not the doctor for you. And it's worth finding someone who is supportive, whether that's someone locally or now you've got access to all these online doctors, right? Including
Yeah.
myself. We have 5 lifestyle medicine doctors that cover all 50 states, DC, international. So we are very knowledgeable on how to help people through that transition of going from, a sedentary lifestyle, a poor diet, all of that, to a whole food plant-based diet, a healthy lifestyle, and what that means for your medications and your health, and just
Okay.
being supportive of that whole process too.
So Linda is asking, what is the name of your practice? Love Life Telehealth. Tell them.
It is, yeah, Love Life Telehealth, and the website is telehealth.love.life.
Telehealth.love.life.
Yeah.
And then on there are all of the different lifestyle medicine physicians, including you.
Mm-hmm.
And each physician has different states that they're licensed in. Is that how it works?
Exactly. Now, some of us cover the same states because if we have, like California, we get a lot of patients from there. So we have multiple providers there, but at least there's at least one doctor that covers every single state.
And so, like, if somebody is coming with heart disease, or they just had a stent and they want a lifestyle medicine physician, are any of you specialists, or do you need to be specialists, or how, like?
I wouldn't, well, we're not necessarily specialists. Most of us are family physicians.
Mm-hmm.
And so we do refer patients to specialists, and we
If
know
necessary.
people, if necessary, we know people who are more lifestyle medicine supportive or plant-based themselves that sometimes do online appointments, so we can refer people that we know are going to be supportive. So that's what I usually focus on if I feel like we need to have a specialist. But I will say, as a lifestyle medicine physician and a family medicine physician, we feel the need to kind of help people in their entire health process, right? So one thing that happens a lot is you have all these different specialists and none of them are talking. None of them are telling the other, oh, I changed this medication, or this is what I want to do. And it's really frustrating for a lot of patients. And so as you know, as a trained family doctor, your goal is to kind of help people through that and be that common voice. And so often I will talk with patients who will get a scan from a doctor or they'll get labs from a doctor, and I will have them upload those to our portal so that I can review them and really talk through, because I have the time. That's what's great. We have these nice long appointments. I have the time to really go through and say,
explain it.
for you, here are the benefits of doing this treatment that your doctor wants to do. Here are the risks of that treatment. And I want you to decide for yourself if that's something that you want to do. And don't just take it, just take it for their word that that is something that you need to do 100%, because no medication, I mean, besides a few, are you need to do this 100% no matter what, or you'll die,
Yeah.
right? Most of the chronic lifestyle related diseases are just that. It is a chronic lifestyle related disease. That does not mean you need to be on that medication, that you get to decide if it makes sense for you.
I did not know that. um, I don't think anybody else knows that, because the only people who don't know who knew that, I do have a certain subset of clients who come to me and they have refused to take the medication. And I always thought, if it's being prescribed to you, there's a reason it's being prescribed to you, right? If you're not going to like fix the problem, lose the weight, fix the problem, change your lifestyle, whatever it is, then you should be taking the medication. But if you don't take it, you're not going to die. So,
Well, right. I mean, because the thing is all medications have risks associated with taking them or side effects. So
well,
you need to
and
be
I
willing to
do
take those
know,
on.
I do know other clients who like stay on the low dose of blood pressure meds just because they've never not been on it. They'll just stay on it. They'll just never ask to come off it. And they
Right.
don't have, and they're following the whole food plant-based lifestyle and they lost all their weight.
Mm-hmm.
And I'll be like, why are you still on that? Do you want to be on that? Like,
Yeah.
and they just feel comfortable. And then
Well, yeah.
I have this other question from two women in the group. One is the diabetic that I told you about, and another one is a woman who has slightly elevated high blood pressure and only one kidney from a car accident. And both doctors in both situations said that they both have normal blood pressure, uh, both of them now, and they are in the normal healthy weight range, and they're following whole food, plant-based, no oil. And in both situations the doctor said, I'm keeping you on this blood pressure meds to protect your kidneys.
Mm.
And neither woman understood what that meant, and neither do I. What are they
Yeah.
talking about?
Yeah. So that is a thing. So that is so actually we brought up one of those medications already, an ACE inhibitor. And then there's something called an ARB, or an angiotensin receptor blocker. So those two medications are commonly used, I would say mostly for kidney protection. We're talking about people with diabetes who already have the possibility of decreased kidney function over time from diabetes.
Right.
And what they found is that by taking one of these medications, it helps prolong the kidney function a little bit. So, because if you have high blood pressure, so first of all, if you have diabetes, you have lots of sugar going through your tiny little capillaries and everything that's going into your kidney. That sugar over time can damage those blood vessels in your kidneys and cause them to not be able to filter as well. And that's when you get protein kind of spilling out into your urine.
Yeah.
Same thing with high blood pressure. When you have really high blood pressure, that high pressure can also damage those tiny little arteries, the same way that it can damage them with diabetes.
But neither
And
of these women
right.
have the current diabetes problems or the high blood pressure problems.
Right. And so it's a little tricky because now there are doctors that are saying whether you have high blood pressure or not, I want you to be on this medication to help protect your kidneys. But I will say the benefit is really mostly in people who already have kidney damage. So if you've already got kidney damage, you get more benefit for being on that medication. This is a tricky scenario, and I feel like this is absolutely the reason you need to talk to a supportive provider who can really talk through that and let you know, are you really one of the people that might benefit from that medication for
Neither of
protecting your
them knows
kidneys?
for sure.
Right. Because chances are you may not be one of the people that would
Or
most
you
likely
might
benefit.
be.
Well, and the benefit, basically what the studies have shown is that the benefit is that yes, it may decrease the amount of protein in your urine. Yes, it may delay the um, the decrease in kidney function over time.
Mm-hmm.
Basically, just slow the progression. It's not going to stop it. It might slow the progression over time, but it doesn't make any difference in when you die. So mortality, it doesn't make any difference in that. And so, you know, why are you? And it doesn't delay, kidney failure either. So you really have to look through and make sure that this is something that, because all medications are going to have people that, yes, probably the benefits of that medication outweigh the risks for them, but you can't just blindly put that on all people. So all
Yeah.
diabetics or all people with high blood pressure. And so it really is a case by case. It's hard to say with these two people whether or not it makes the most sense for them. But that's where I love to go through everything, go through all the data and really determine whether or not it makes sense for that person.
You like to sleuth it out.
I do. I love to sleuth it out. Yeah.
It's so funny, but it's so rewarding to sleuth it out and watch a woman shed the pillbox,
Yeah.
that clattering pillbox, and realize that she has the power within herself to keep herself healthy. She doesn't need
Right.
pills. It's amazing.
Yeah.
Got goosebumps again. All right. Um. Okay. So, what's the usual timeline? You mentioned something really interesting that I learned, which you said before, which is like if you know that they're really serious and they're going to do it, whole food, plant-based, no oil, 100% all the way, you'll start deprescribing right away.
Oh, yeah.
The question was, what's the usual timeline for how you would deprescribe the meds, assuming somebody was 100% whole food, plant-based, no oil? And that is what I'm prefacing it by. You can't be half in, half out, some yes, some no. Has to be 100% whole food, plant-based, no oil. And that's especially if you have serious health conditions and these kinds of chronic conditions that you want to reverse.
Yeah.
So what's the timeline like?
Yeah. Yeah, so it's going to be different for everyone, and it's going to be different depending on what disease process we're talking about. But we already mentioned type 2 diabetes and high blood pressure. Those, it's pretty quick. So those two specifically, I would recommend talking to your doctor ahead of time so that you have a plan,
Ah,
right? So you can say, hey, if my blood pressure starts to drop, when should I, when would you decrease my medication? So like, let's say today on my 2 blood pressure medications, my blood pressure is 130 over 25. When would you have me drop one of those medications? How low should it get? And they might give you a range and say, okay, well, if it got this low and you started feeling dizzy, then yeah, I'd have you skip that medication, right? So that you know what to do, so that you're not just, boy, I can't get a hold of my doctor. I don't know, is it dangerous for me to stop this medication? So that you really do
yeah.
have a plan.
I like I like the point of having like a plan like that, because it's a little bit of like a manifesting energy. Like if I
Yeah,
know that I'm trying to get to like this range in my blood pressure, I can like think about that and I can like
yeah,
sort of get my mind on board with it. Like, what am I looking for to get off this med? That is really
exactly.
powerful.
Yeah, and I often will do that with my patients, give them kind of a breakdown of, until we meet again, if this happens, I want you to skip this medication and let me know, right? So I'm kind of giving them that plan in advance so that they don't feel like once they're feeling those symptoms that they're just, what do I do? It's a Saturday night. I'm not going to get a hold of my doctor on a Saturday night. I don't know what to do,
So
right?
you're so right. And this
Yeah,
way we know what to do.
yeah,
And my second takeaway is that it's not life threatening. if you don't take it, like if it's not life threatening.
Exactly. And these chronic lifestyle related diseases, typically you're not on some, you're not going to be stopping something that is life threatening. So if you're a type 1 diabetic and maybe you do have on top of that almost like a type 2 diabetes, you have
You're
a
insulin
metabolic condition,
resistant.
you're insulin resistant. In that case, you're not going to want to stop all your insulin because that could be very dangerous in someone who is insulin dependent.
Yeah.
But you want to have a plan because a lot of my type 1 diabetics require less medication over time. So you do need to still have a plan for how to decrease that over time. But you don't
So
want to just decide to stop
no,
something
no.
unless
So
you've
we're
had
just
that.
to be real clear with each other and
Yeah.
everybody on this live stream. We're not talking about you just going off your meds. We're talking about working with your physician to come off your meds. So anybody who's watching, if you have any questions for me or Dr. Nikki, go ahead and pop them in the chat there so that we can answer these. So one thing I want to say is that what you said, everyone is different and everybody's body responds differently to the whole food, plant-based, no oil lifestyle. And so like, while one woman might have decreases in glucose, another might have decreases in blood pressure, and yet another one is going to have a very fast response to cholesterol, which she won't know about until she gets a test. But some women, it takes a really much longer time to see the A1C drop,
Yes.
because 3 months, right? Or to see the cholesterol come down. Or also, depending on how heavy is she, how much weight is there still on there. If there's a lot of fat there,
Yeah.
it takes longer. But some women, no, it
Mm-hmm.
doesn't. So
It's
every,
true. That's very true. And I've had, where people have improvement in cholesterol within a week, right? You're
yeah,
you're checking it a week later and their total cholesterol has dropped by 50 points or even more. And then other people that make that same change and they say, why isn't my cholesterol moving? Why isn't it working?
yeah.
But if you give it enough time, it comes down eventually. So that is something that, unfortunately, in this world of social media and YouTube and all of that, we tend to see the best stories of these remarkable outcomes, which I've seen, but I've also seen the opposite of that, where people get frustrated, and it takes consistency and it takes time to see those changes over time. So being patient and allowing the process to happen.
And the consistency is the key. If you get frustrated and then you go eat a donut, you thwart the process like very seriously, actually, because then your body actually doesn't know how to respond, and you think, oh, it was just a donut and still why isn't it working, but you really slow down the process. So
Yeah. And then you're getting yourself back into the pleasure trap again, right? Now
back into
that
the
one
pleasure
donut
trap. Yeah,
is causing you to crave that again the next day.
100%.
So
Okay. Okay, so that is the timeline. Okay.
yeah, and I mean,
Um,
and in addition to that, you think about cholesterol, that's something that you can check pretty frequently. So I will often do that with people who want to get off, say, a statin medication. We'll just check it over time. And once it starts to drop to a certain level, then we can take a trial off of that medication, make sure their cholesterol is still staying in a healthy range, and then they can stay off of it. There's no problem with getting off a medication. um, you know, you can always restart it if it's needed, right?
yeah, you can always just pick it up again
You
if
can
your
always pick it up
levels
again.
rise for
Yeah.
some other reason that we didn't know about, right?
Well, and I do tend to see people where they get nervous about getting off medications because they have been on them for so long. And I let them know, I'm nervous that you are still on this medication because it can be causing you damage. I think we just think that a medication is just something that's meant to be good for us. And I've been on it so long, I'm worried, what's it going to do when I get off of it?
Yeah.
But so that is something that I see a lot, is people get really worried about getting off medications that they've been on a really long time.
Do these medications need to be like tapered down very gradually, or can you just cut the pill in half and go on your way?
Some of them do. That's why it's
Some.
so important to work with your doctor, because some do
Okay.
need to be tapered down. Yep.
Yeah, because
So
like the anxiety and depression meds, we know that those always need to be tapered down or titrated down very carefully. But
yeah, but there are, certain medications like for blood pressure, metoprolol, like a beta blocker, those have to be tapered. So knowing those kinds of things, you don't want to just stop cold turkey and have a problem from stopping that medication. Talk to your doctor about that
talk
so you can come
to
up with a
your
really good plan.
doctor.
Yeah,
And I would really say that it is so worth it to have a lifestyle medicine physician to talk to about this because you have the time. Because you
yeah, the
have
time
the
and
time to explain this. There should never be some woman coming to me going, "Oh, my doctor says it's for my kidneys." And I'm like, "What does that mean?"
right,
That's
right.
two blind people leading the blind. So,
Exactly. Yeah,
uh,
exactly.
yeah. And I think it's like one of the most worth it investments to have a physician hold your hand through this whole thing. The same
Right.
way, go ahead.
Oh, I was going to say, because not only do we have the time, but we are trained as conventional doctors, right?
Yeah,
So
you
we
are
have the same
doctors.
training.
Yeah.
Yeah, we're doctors, we're medical doctors and doctors of osteopathy. And so we have the same training as your regular doctor who is putting you on this medication or not wanting to stop the medication or not really sure if making these lifestyle changes is going to help you get off the medication. We have that same training. But in addition to that, we help people all the time with this exact
Coming
issue is
off the
when to get
meds.
off the medications, how to get off them safely, which ones make sense to keep, which ones don't, right? So we know that very well because these are the people that we see all the time. We see these people coming to us very motivated, wanting to get better, wanting to get off the medications. So we get
Key,
both of
key,
those.
key word is very motivated. Motivated, ambitious women who want to take their health back.
Yeah.
That's who is really getting off their meds. That's who is working proactively with their physician or seeking out a lifestyle medicine physician to do this with them, if especially if there are other extenuating circumstances. Like it's tricky for a type 2 diabetic, insulin dependent type 2 diabetic with high blood pressure and high cholesterol and whatever else. That is a tricky situation. Like it
Yeah.
needs to be seen by a physician.
Yeah, I mean, I had a patient one time who was on so much insulin. I'd never seen anyone on so much insulin
Mm-hmm.
before. And she made the change to going whole food, plant-based, oil-free on her own. And she was seeing a specialist. She was seeing an endocrinologist who just was not used to seeing these big
Yeah,
changes. And so it was kind of tweaking her meds a little bit. But this patient came to me saying,
not enough.
I'm eating all these sugar tabs constantly and I can't keep my blood sugar up. I'm like, oh my gosh, you're over
Yeah.
medicated. We need to stop. We need to stop this right now. We need to stop these medications right now and just give your body a chance to breathe. And then we'll add them back on and see where you're at. And I mean, she ended up going from 500 units of insulin a day to
500
20.
units? I've never heard of that.
I know, to 20. I mean, this took some time to get to 20, but she was so over medicated when I first saw her. And again, her endocrinologist doesn't see that every day,
Yeah.
doesn't see these big changes because, you know, most of the time they're seeing people getting worse over time and they're adding medications. That's what they're really good at.
This is so exciting what happens in my groups here and what happens with my clients and your patients to see them like just ditching the meds and going back to their lives. There's a woman on the live stream now. Her name is Ramona. And she did not have that much weight to lose, but she still had high blood pressure and terrible knee pain and stopped her from running marathons, which is something she used to love to do when she was a little younger. And she just couldn't anymore because it was so painful and because of the high blood pressure. And she did this whole food, plant based lifestyle. She started losing weight first week. 6 weeks later, she was completely off the blood pressure meds and back to running races again, like 5Ks, 10Ks. She's going
Wow.
to run a half marathon. I'm like, what the actual? She's 73 years old.
Wow.
So
Wow.
what you can do for your life is just amazing. That's all I'm saying.
Yes. And
So
I see it all the time. That's the thing, is we're not just talking. Like we actually see this happening. You see it with the people that you work with. I see it with the people that I work with.
Yeah. Even on the retreat that we did together,
Yeah.
5 out of the 8 people lost weight in the 5 days that they were here eating this way.
Eating a ton of food, by the way.
A ton.
Lots. I mean, I was piling it on my plate. That's the beauty, is we're not asking people to eat rice crackers, I mean, it's a delicious way to live. The food is amazing. You get to eat a lot of food until you're full, until you're satisfied, right? So it's not like this weird diet that, oh, you got to be so strict and feel horrible. It really is. Once you get through that initial hump of, yes, the learning curve, that's hard. It is. Anytime you make any sort of a change in your life, it's hard. You get in this routine and that becomes easy and second nature. So you've got to get this new lifestyle into that same place. And once you get there, oh, it's just lovely.
So of course
it's such a weight.
What I specialize in.
Yeah, yes.
That's my specialty, is the systems and solutions to make it delicious and doable. And that's what we're doing here. Anybody who's on this live stream or listening to the replay, comment plants over pills if you want to talk to me about getting my help with your whole food plant-based lifestyle to lose the weight, to actually reverse, to solve these health problems, and to get off your meds. Because if you want to go from just settling in your life and just blindly following doctor's orders and advice to take meds and you don't even know what they're for, I'm here to help you take back your life and take control. And so is Dr. Niki. And that's what I want you guys to go away with, is that we want you to take control, and we're here to help you with that.
And that is why I have sent plenty of my patients to you who need that extra help in figuring out, what am I going to eat? How am I going to make this something that I can do? Right? I help them with the medication stuff, and then you can help them really dial that in. And the patients I've sent to you have been loving it and have been successful.
It's such a great partnership. I absolutely loved having you on these live streams. Is there anything else that you want to say to everybody listening?
I just want to reiterate that is your health, and there's no one who's going to care about it more than you do. So you need to advocate for yourself.
100%. There's nobody going to care about it more than you do. So if you're worrying about, what is my husband going to eat, and me, then you're not going to get well. And if nobody's going to care about it.
Yeah. And if you're relying on your doctor to do the best for you,
same with him.
You have to add, exactly. Like they care enough to try to do what they think is right, but ultimately you need to take control of your own health, be educated, and make sure that whatever decisions are being made for you are something that you agree with.
And then you know what they are.
Yes. So, go through, get that list of your meds, know what you're on and why.
So we just finished a foodies retreat in February. Janelle came and she says, I lost a pound the week I came to the foodies retreat. And let me just tell you, Niki, at the foodies retreat was just a tad different than the weight loss retreat that we did together.
Which I know someone who came to that foodies retreat with you.
Cheryl.
Who was yes, Cheryl.
Cheryl was here. Oh my God. So much fun. She brought me some of her homemade garlic powder. You know how she grows
from their garlic? Yes, I do know.
She made me homemade garlic powder.
Wow.
That's what she did.
Wow.
But the foodies retreat, I would say, was a little higher in fat and a little higher in bread, like bread, pasta, wheat, things like that, because we had coconut milk and we had tahini sauces, and we really, every day, I would say. So it was actually higher in fat than what I typically eat and what I would typically advise on a weight loss journey, because they were here to celebrate food, and most of them were already clients who were at a healthy weight, who already got off their meds. And so that's what we were doing. And here's Janelle. She lost a pound the week she came to the retreat.
I love it. I love it.
Ate a ton. Oh my God.
And I love food.
Fun.
I love food. You know, I eat a lot of it and it's delicious.
It's
You
delicious.
know, it
Okay.
is.
So, tell everybody again, what's the website, how people can get in contact with you to find a lifestyle medicine physician or you specifically?
Sure. So the lifestyle medicine doctors that I work with are at Love Life Telehealth, and the website is telehealth.love.life. And if you just want to, yep.
Telehealth.love.life.
And if you are interested in just finding more information about me, I also have my own website, drnikidavis.com. It's drnikidavis.com.
And Dr. Niki also does whole food plant-based ladies retreats in the
Yeah.
Southwest. She also does some retreats. And so you should definitely follow her.